Hi, I'm Dr. Hannah Hamlin. I am a physician with type 1 diabetes. I'm a general practitioner and a diabetes educator with background in lifestyle and nutrition medicine as well. And I'm going to talk today about sleepovers for your teenagers with type 1 diabetes because this is a topic that I think a lot of people have different opinions about. And so I just want to share my experience. All teens are different. They all need different levels of support. This is absolutely not medical advice, but a different perspective than maybe you've heard before, or just a way of looking at things that maybe you haven't looked at. I think that this is a topic that's really, really important because one thing that makes living with type 1 diabetes more challenging than just the highs and lows and the numbers that come with it is the psychosocial impact. So the impact of how we feel that we're able to relate to other people in our life, how we feel for ourselves, our sense of self-worth, our sense of how deserving we are, how lovable we are, and our ability to connect with others and create a community while we're managing our blood sugar levels. And so that is crucial when we look at this. I think one thing I've learned more and more as I went further into my medical training is that holistic health is important. We can have the perfect diet, the perfect blood glucose management, the perfect exercise plan, and kind of live in this little box. But if we don't feel that we're lovable, or if we don't have friends in a community, we're not really living a whole, happy, fulfilling life. And I think for everyone, that is the goal, is that we feel like we can be our best selves with type 1 diabetes. We feel like we can live a happy, healthy, normal life with type 1 diabetes as much as possible. And so with that, sleepovers are part of it, especially for, teens that have a friend group that is already doing sleepovers and they feel really unincluded. So when is it safe to make this happen? What are expectations you can put on the other family or the other parents? And how do you even do this? So option number one that feels most straightforward is if you have the ability to host a sleepover at your home in the beginning of your child's transition into sleepovers. That can be a great option because it's easy for you to keep an eye on their blood glucose management. Step number one. So that might be a great place to start. Step number two with sleepovers is really looking at your teen and understanding where they are with their current ability to take care of themselves. So you may want to have a conversation with their endocrinologist, with their pediatrician, and kind of come up with a plan that feels like a safe plan based on their current knowledge. If you feel like you have a teen who is not yet able to manage their own insulin dosing or manage their own low treatment or carb counting, maybe those are tools that you could create goals around learning together so that they could create more independence. That's a really great pull. I think if we've got kind of this prize of being able to go on sleepovers once we learn certain tools, it certainly could be motivational. But what is important from an expectation level is understanding that you have options. Now with continuous glucose monitors, it's amazing because you can actually keep an eye on your kid from your house if you have the Dexcom Follow or different versions of that set up with the different CGMs that are out there. Now, I would say a great way to think about this is if we kind of zoom out on a timeline and we look at what happened before all of this technology, because I think that we've gotten so used to always being able to see our child or our teens blood glucose levels and sometimes even, their insulin pump, the basal rate, kind of depending on what form of technology you're using, helping them bolus remotely. We've got all this tech out there and that's wonderful. But I want you to know that before we had insulin pump therapy, before we had continuous glucose monitors, there were lots of teenagers with type 1 diabetes that went to sleepovers on their own with their shots and their finger stick meters, and they did just fine. And I was one of those kids. I didn't start using a continuous glucose monitor until they really became more popular when I was in mid-college. And so I was diagnosed with type 1 diabetes at age 13, and I did tons of sleepovers in high school with gaining confidence that I could take care of myself. And I think sleepovers really helped me because they were these little baby, 12, 16-hour periods where I was in charge of my diabetes. And so I learned to gain confidence. And when I left for college, I knew that I could do it on my own. I knew that I could handle my own healthcare overnight. And that is really important. I think it's empowering. And every child and teen may get to this time frame, in their own speed. But gosh, I was so grateful that I could rely on me for my diabetes care because it made me feel more empowered. It made me feel like I could trust myself. It made me feel like I could do more things that I wanted to do because I knew how to take care of myself. And what I see today is sometimes with this constant parental supervision of CGMs and insulin dosing, it's so good that we have that access. But sometimes the kids don't get enough of the autonomy. They need to learn the skills on their own, learn that empowerment. And again, talk with your physician about when this would be right for your kid, because it's going to be different. But that's so important. And I don't want people to miss that, because I was able to go through high school, learn how to manage my own type 1 diabetes, be completely independent from the minute I left for college until today. No one has really, from a family or friend perspective, given me any advice on what to do with my blood sugar management since then. It's all been kind of me and my doctor's appointments or the books I've read or the people with type 1 I've talked to. But I haven't had anybody needing to have oversight. There have been lots of times where I've had roommates or I've lived with someone else or I've lived alone, and it's been okay in all of those settings. I've never had a hypoglycemic seizure. I've never had DKA. It's doable. We don't need someone else to micromanage us in order to stay healthy. And I think that can start in the late teen years personally. Now, again, I definitely don't want anybody to give their kid the reins before they're ready, but it's possible, and I do think that having that extra responsibility early on probably set me up for success in other areas of my life. I could rely on me to take care of my diabetes care. I learned that discipline. I learned how to do something hard. So I could rely on me to figure out how to take a harder class and make a decent grade or pass it or, whatever it was. It helped me build confidence within myself. And I think that's wonderful. So with that kind of big picture, we zoom back in now to your life with your teen at home, understanding what would be safe. I think that first, if you have the ability with where your teen is to empower them to learn what to do when they're at a sleepover, that's where I would start. Then I might give the parent some backup information as a secondary measure. I wouldn't ask them to bolus my child with insulin. This is all very hypothetical. I'm pretending I have a teenager and I don't have kids, so take that with a grain of salt. I do think that I might have the parent know how to use Baqsimi. I mean, it's about as easy as Flonase, so a lot of people can figure that out. Just leave it there, have them, know about it, and then just tell them if they're concerned about your kid to call you. And then you can do it over the phone, or your kid can call you. I think when we put too much pressure on the parent team that they're staying the night at, that's probably not in your kid's best interest. I don't think that is empowering, and I think sometimes it's not really fair to the parents because that's a whole bunch of medical liability you're putting on them. I mean, even as a physician, that would be hard, I think. So obviously, if you have a parent who's really interested or they have a niece or nephew with type 1, it might be a different story. But I don't see why not, and please let me know. I'm sure this will be a controversial video because I've had a lot of big discussions with parents about it over the years, but I don't see why you couldn't ask your older teen to set an alarm at 3 a.m. to wake up and check on their blood sugar. I mean, I've done that. I did that for many years, prior to having blood glucose pieces, or teach your teen how to wake up, find a Dexcom alarm or a Libre alarm that is going to wake them up at different levels that you feel like they need to wake up for. Teach them what to do if they don't already know. These are things that are important. Make sure they take their own low snack so they're prepared. You don't have to rely on whatever type of carbs that other family has in their kitchen. I don't think that has to be such a big deal. I think it can just look really scary if we're used to always having the data and always co-managing and having decisions made with our kids. Now, I also think that if we do this too early, it can put a lot of extra pressure and stress on the child, which can feel almost like they have to grow up too fast. It creates stress for them. And this is a stressful thing to learn. It may be stressful at any time, but we want to be careful, with that piece. And so that's why I think you got to know your teen, you got to talk to their doctor, you got to come up with something together, you got to find the right parents, and figure out, what level of support you think that they can handle. But I don't think it has to be complicated. I definitely don't think it has to not happen. I think the idea that your kid has type 1 and so they can't do sleepovers at other people's houses is disempowering. If the goal is for them to learn to take care of themselves as an adult, and if the goal is for them to be able to live a happy, healthy life with community, I don't think that that's a great choice long term from a psychosocial impact. Now, I think people can be safe and do sleepovers. That's my very personal opinion, very generalized, not individual advice for your kid. But I know that there are parents out there that are just very nervous about sleepovers, aren't sure that it's even possible. And so I wanted to make this to share my personal experience and tell you that there may be more options than you've already considered. So I hope that was somewhat helpful. If you have specific questions of other topics you would like me to cover or other things related to this, please let me know. If this was helpful and you're open to liking and subscribing for this video, it really does help me be able to create more just like this. Thanks for listening.